Healthcare is not one of them. This is not a refrigerator. It is not a television set. And it is something that is not only a necessity, but it's something about which we can't look at the picture and say, yeah, I like that picture, and that'll fit in my house, so I'm going to get that TV set. We simply, individually unequipped. I'm unequipped, and I feel like I've spent a lot of my time thinking about healthcare, and I'm unequipped. He described what happened with credit card companies. Supreme Court the law had previously been that the law that applied to your credit card agreement was the law where the borrower, that is you as the credit card user, lived, not the law of the lender, the credit card company. The Supreme Court said no, it was the law of the lender could apply. So the president of Citibank calls the governor of South Dakota and says, I'll give you 400 jobs. 400. If you want to know why your credit card comes from South Dakota, 400 jobs. 400 jobs if you will pass laws really favorable to the credit card companies. It took them 24 hours. If you don't think exactly the same thing, it's not like they don't know this, exactly the same thing is going to happen with respect to health care if we were ever to enact this thing where we didn't have the protections, unless, of course, there were federal protections, which is what I'd most like to see. Right. I know that there are a lot of people who sincerely believe, and having grown up, frankly, in the military, which is a single-payer system, I have no fear of a single-payer system. But I can understand if you were in the middle of chemotherapy or something like that, and somebody said, "Okay, everything's switching tomorrow." You say, "Wait, I'm not ready to do that." So, to make the transition easier for people, it allows any sort of a hybrid that allows people to create a level of comfort before they move to Senator Obama has as one of his insurers, and my husband did too, as one of the insurers who are available, not only the private insurers, the Blue Crosses and the United Healthcares and whatever, there'll also be a public insurer. And the public insurer would be kind of like the Clinton insurer in a sense, that Medicare Plus or some other, whatever kind of language you want to use it, and people can opt to choose that for their health care. Kind of think that at first people aren't going to jump to it. I don't think people are going to jump to government health care. But considering that the overhead is so much lower than it is, 3 or 4% as opposed to 30 to 40% by the private insurers, the same dollars are going to probably get you more. So maybe your next door neighbor decides to go and you realize that you had to pay for something that they had covered, and I think you will gradually, over a period of time, see people gravitate towards that more comprehensive policy at the same price. But there are also things that insurance companies don't cover right now because they need to make money, so they cut things out. Actually, do have to do with you. HPV vaccine is only required in 16 states to be covered on a comprehensive insurance policy, which means that if you're a woman, you want to get this vaccine, maybe it's covered and maybe it's not. Because the insurance companies are making a cost determination that doesn't serve you. I think the chlamydia was 6%. Was that right? 6% of states, 6 states require that to be covered. Infertility treatment is 23 for in vitro, I think, and 6 or 8 for other kinds of fertility treatments. And as I said, maternity 21. These are all issues that really only affect young people. But the insurance companies are making these decisions because they have a profit margin to protect. We talking about Canada. I ran into the woman who had worked in a hospital in Vancouver, and she had moved to Boston. Met her in one of the New Hampshire primaries, and she said she worked in the accounting office in the hospital and went to a hospital in Boston to get a job. Same number of beds in the hospital, in each of the hospitals. She got a job. She had worked in an accounting office with 6 people. She now worked in an accounting office with 600 people. Your health insurance dollars are being used to pay those 600 people. It is not an efficient use of our money, because they have these different ways of trying to collect, trying to cover, trying to make certain. So everybody being insured eliminates so many of this game playing. You know, this is a shell game that's going on, and it eliminates a lot of that nonsense and allows us to really focus on how it is we drive the costs down. And the fact that we might feel that we're somehow protected because our health has been good until October of 2004, the only time I ever went to the hospital was to have babies. You know, I was perfectly healthy. You have no idea. So what's coming down the pike at you. Now, what do you do about defensive medicine? You know, I think that we probably do need to find some way to make certain that people are not ordering tests simply because they don't want to be sued for not giving not ordering the test. But somebody maybe needs to be intervening in a way, and I don't know how to. I have no idea how it is you do this to basically say that this is the treatment. But the one person who can't do it and who would do it under the McCain plan is the insurance company. Shouldn't be making that decision about whether or not the test is covered. But the doctor, the patient, and maybe some sort of board when the doctor thinks this is really unnecessary treatment, but wants to protect themselves.